Let's jump right in with a question from Janae. Let's see what she says. And her concern is the following: how much melatonin is recommended when you can't sleep? Great question there, Janae. Doctor?
Yeah, so melatonin, as you know, is readily available at most drugstores in the vitamin section. We don't see a real clinical difference once people take above 3 milligrams. Um, so we would say under 3 milligrams or 3 milligrams. Melatonin really only has a very mild sedative effect.
All right. And doctor, I've been reading somewhere that people are also vaping melatonin. Is that safe and effective?
So it is not a safe practice to be vaping for several reasons. One is the potential lung injury of vaping, period. The other issue is that the melatonin will be delivered to the lungs directly, immediately, which is not the normal way that melatonin is secreted or utilized in the body. Normally, melatonin is secreted when it is dark out, and it has to do with a signal from the eye to the brain that then secretes this neurohormone. So, one, vaping is potentially delivering too much of a dose of melatonin and too quickly. Third problem is potentially people can have lung injury from vaping. So it is not recommended.
All right. And doctor, how long does it take for melatonin to get into your system, for example, when you take it by mouth? Because sometimes people think they're going to take it and then immediately it's going to start working. How long does it usually take?
It could take about 30 to 45 minutes.
Okay, so one should just wait a little bit, kind of put the ambiance, if you will, in the household. Let's talk about those kind of good bedside habits that are important. I hear cell phones, not a good idea.
Correct. So again, coming back to melatonin, our brain is designed that when it's light out, be awake. When we sleep is when it's dark out. So in a way, melatonin is considered a dark signal because again, when it's dark out, that's when our brain starts to secrete melatonin. With our modern society and electronics, including our modern cell phones and iPads and electronics, any of that intense light close to bedtime can reduce our own melatonin production. All electronics should be shut off, ideally 2 to 3 hours before bed.
Doctor, I have a question from Lynn, and this is what she asks, and I think this is a great question. Does menopause or post-menopause cause sleep disruptions, and what do you suggest for how to fall back asleep after waking up at 2 a.m.? Lynn, yes, ma'am, I can relate. Doctor?
100%. So we're learning more and more about the complexities of sleep. We now know hormones are intimately tied to our sleep quality, quantity. Unfortunately, with menopausal changes, as we reduce our natural production of estrogen, progesterone, it will influence sleep quality, unfortunately, in a negative way. So it is a somewhat natural phenomena. Approximately 40% of women going through menopause, postmenopause, can develop some sort of sleep disturbance, and predominantly insomnia. Of course, hot flashes and fragmented sleep is also can be a symptom of this. To the second part of the question is, so if you waken at 2 and can't go back to sleep, that's a complicated question. One advice I give everyone is to keep an extremely strict sleep wake schedule, meaning an exact time to go to bed, an exact time to awaken. And if you start to awaken early, set the alarm for your desired wake time and then turn the clock around. So even if you're awakening at 2, 3 in the morning, do not check the time. Otherwise, you're teaching yourself to wake up at 2, 3 every day. Third, quick advice I would give you is if you awaken early in the morning, really just cannot sleep, the best thing to do is leave the bed. So if it's after 15, 30 minutes, instead of laying there frustrated, we're better to leave the bed and do something relaxing, reading, for example. If we're tired, go back to the bed.
And definitely maybe not do a thriller, because sometimes when I'm reading a thriller,
Right.
then I just can't even go back to sleep.
Exactly.
Make sure it's a love
100%.
story or something like that, right?
Exactly.
Oh,
Yeah, something a little
goodness.
boring.
There you go. Doctor, I have a couple questions from Jackie, and they're follow-ups to the melatonin topic that we were talking about. So here's the first one. Can you get addicted to melatonin? And Jackie wants to know, can melatonin help with menopause-related sleep problems? So can you chime in on those two, please?
One, no, you cannot get addicted to melatonin. As a side note, I actually have many patients who get concerned about reducing their own natural melatonin production, and that does not happen with utilizing supplemental melatonin. Truthfully, as we mentioned earlier, melatonin has a mild sedative property, but the predominant way we use melatonin is for people with circadian rhythm or biological clock issues, because the melatonin directly impacts the clock in the brain. So, as an example, shift workers or people with jet lag can benefit significantly from melatonin.
And doctor, I want to just talk about sleep in general. Why is it so important? Are we sleeping enough? And what, I guess, is considered a good amount of time to sleep in terms of hours?
Great questions. So, it's in some ways well known that what the most prominent issue in the United States is what we call chronic partial sleep deprivation. So, meaning many Americans, we sleep, but we're not getting enough sleep. That quantity of sleep is not enough. What do we need? It is approximately 7.5 to 8 hours. There's a little debate about, some people will say 7.5, some people say 7.75, some 8, but no one says under 7.5. There are very few people who may get away with less. Some people require more. But in terms of the bell curve, the vast majority of humans require 7.5 to 8.